Okay, Wilson, am I audible?
Yes, you are audible. Yeah, we can start.
Okay, excellent, excellent. So just tell me how many people we have in the room.
Yeah, we are now 19.
Oh, excellent, excellent. Okay, so we have about seven on the call. Okay, so we are good to begin. All right, excellent. So I hope I'm audible to everyone, both sitting in the room and on the call. So welcome everyone. This is the first physical certification ceremony that B-Skilled has organized after 12 cohorts of this program that we have run globally, and after certifying close to 350 supply chain professionals from 50 plus countries from Sub-Saharan Africa, South America, and Asia. So I think this is a big occasion for everyone, and I congratulate everyone. All of you who have been able to finish this program and present with us today to receive your certificates. I sincerely would like to welcome Dr. Chabaya, the Secretary of IAPHL Zimbabwe chapter. Then Ms. Petronella Murambinda, who has graced the occasion and is our guest speaker for today. And of course, our own Wilson Chandomba from CM Coms. I don't think we will be able to, we would have been able to manage all this without his hard work that he's put together with the entire IPHL team. So I want to congratulate everyone. There are a couple of members from B Skilled who are going to join online very soon because as I am speaking with you, there is another session going on in Madagascar. So as soon as they get free from there, they will join this session as well. So without further ado, let's start today's proceedings. So, after about 2 months of rigorous training and about 7 modules and a very difficult final assessment, we have 35 certified professionals from Zimbabwe, which is a great, great achievement for everyone who has been involved. And today is the time when we felicitate all of you who have been, with us for these last 2 months, have spent your precious time and your money to achieve this CPD certification. And as you see on the screen, I think all of you should clap for yourselves. And let me start doing this from my side. And everyone on the call and everyone in the room, please clap for yourselves and pat yourself in the back that you have done it. Um, it was a great journey for us as well to launch this first cohort in Zimbabwe, and I can say with a lot of pride that it has been an excellent, excellent journey, and we have just started. So get ready to learn with us and become much better supply chain professionals in the coming years. As you can see on the screen, there are a few words from our dear participants who have finished this course. There have been a lot of challenges, like Lynette is saying, like electricity cuts, internet issues, and so on. But still, all of you persevered and made sure that you use technology in the right way to make a difference in your workplace and eventually in your lives. So I congratulate all of you. Um, uh, Mr. Zova said that he liked the content of the lessons, the discussions were enlightening, and the lectures were very good. He said he still is feeling that he should have scored a bit more. But I think in all of you have learned a lot, and I hope that you will use these skills that you have inculcated in these last 2 months to make a difference in your workplace. So, as far as today's agenda is concerned, you know, as I started the session, Dr. Chabaya from IAPHL Zimbabwe will make opening remarks. Then Petronella, who is there, she will talk about her own journey in health supply chain and the health system to motivate all of you. I personally know Petronella for many years now. We have met physically a few times as well, and she has been a champion in the health system in Zimbabwe. And I think she is quite gracious enough to accept these invitations to come to this community session and share her experiences with everyone. Then we will hand over the certificates to everyone. So there are printed certificates with Wilson. Whoever is present physically, they will receive the printed certificates, but we will also show them online so that you all can see everyone's certificate. But everyone else who is not joining today or not in Harare, please contact Wilson to receive your physical certificate as well. Then we will shortly listen to Mr. Makhosi Sibanda, who is joining us all the way from Botswana. Although he's a Zimbabwean, he's a proud Zimbabwean, but he's joining us today from Botswana. He is the highest scorer of this cohort, and he will very specifically talk about his own experience and how he is going to make a difference in Botswana as well. Then, there is a group picture in between. We will try to take it partly physically, and then some of us who are online, we will also try to come on screen so that Wilson will find a way to take the best possible picture where both people who are there physically and virtually, all of us can be seen together. And then, we will close the session where first Wilson will speak, and then the session will close, by the closing remarks of Dr. Chabaya, who's there. In between, we will also hear from a global supply chain expert who will join us all the way from Paris. I will let you know once he joins, and then we'll find a few minutes to hear from him as well. If you have any questions, wherever if you feel that you need to know a bit more, you can either write in the chat, or if it is a very burning question, then you can also raise your hand. People who are joining us virtually, we've already established this that just keep your microphones muted when you're not speaking. But when you receive the certificate virtually, please switch on your cameras so that we all can see you when you are making your small speech while receiving the certificate. Okay. So with this, let me invite Dr. Chabaya, who is the Secretary of IAPHL, to open this session formally, and then we will take us through the rest of the session. So, Dr. Chabaya, over to you. Maybe Wilson, you can point the camera towards him so that everyone can see him as well. Thank you.
Ladies and gentlemen, here present and those who are following us online, feel most welcome. Okay, yeah, I think I'm visible. Good. So I will start to say on behalf of ISPO Global Community, Zimbabwe chapter, and all members here present, and those around the country, specifically Zimbabwe. I would like to welcome you all to this certification ceremony, which came about as a result of our partnership with the Build Skilled Global and CM Coms. Indeed, it's something to celebrate, isn't it, colleagues? It's really something to celebrate. We are very grateful. Well, may I also proceed to acknowledge the presence of our guest speaker, Madam Petronella Murambinda, Product Logistics and the Supply Chain Specialist from UNDP, here present. Colleagues, help me to welcome her. I also extend my acknowledgement to Mr. Sanjay Saha and his team, CEO BizCute Global. Indeed, Mr. Sanjay, we're grateful for your cooperation and contribution to Zimbabwe. Holistically as a country, we are so much grateful for that support. May I also continue to extend my acknowledgement to our faithful partner, a very hardworking soul indeed, and is a soldier who is making all this possible. It's none other than Mr. Wilson Chandomba from CM Coms. Indeed, we are so grateful. And lastly but not least, colleagues, allow me to extend my welcome and my acknowledgement to Mr. May Bimakosi, the interim ISPO Botswana chapter leader, who is following us online. I believe is there. We are also, anyway, to say proud that he's part of, the graduates. He was part of the program, and we are very happy that he is with us today. Of course, all protocols observed. I welcome you and acknowledge your president. Those who are following, those who are listening, feel most welcome once again. I will start by giving a brief background, Sergeant team, on ISPL, just for the members who probably some of them are first-time members in this in ISPL. I would like to say ISPL is a global community of practice that aims to promote the professionalization of the field of public health decisions through education and information sharing. And I think you are all witnesses to this. This is what we are doing here. It's information sharing, learning. That component is part of the ISPO Global Community Agenda. And the community was established in 2007, just for those who are here to know that. The community supports logisticians worldwide by providing a forum for members to network, exchange ideas, and improve skills, such as this one. And I also look for that members take advantage of meeting exchange online, meeting physically here. We share ideas and we continue to do so as a continuous improvement. I also like to mention that ISPO is headquartered in Washington, DC, America, and currently is operating in more than 150 countries, including Zimbabwe. For those who are here to know, the Zimbabwe chapter was launched in May 2019 with the aim of supporting and domesticating public health, logistics and the material supply chain management in Zimbabwe. I would like also to make members know that currently the chapter stands at number 3 in terms of membership mobilization, with a total membership of 467 members. And colleague, if you are here, you're not really a member, you don't have a membership certificate, you're actually taking us back, because our aim is by end of year 2023, we aim to be to double this number, at least 800 members. And we discuss more in other forums to say what are the benefits of us having so much those numbers. It will help us in the visibility and of course, in the acquiring more sponsorship and donors in all programs that you may think of. So if you're not a registered member now, kindly consider registering. Well, I would like also to say in the pursuit of the objectives of the global community, the Zimbabwe chapter has exerted so much energy on training and development, and so far has hosted about 4 trainings in the year 2022 to 2023. I would like to say up to date, we had 4 trainings in collaboration with our strategic partner, CM Corps. Safe to say the chapter has worked with the Medical Control Authority of Zimbabwe and hosted the good storage and distribution practices as applicable in the medical supply chain industry. Further, the chapter has worked with Back Logistics and hosted medical logistics and practitioner training, in 2022. Indeed, colleagues, I would like to believe this is commendable, isn't it, team? It's really commendable, isn't it? Yeah, I would like to believe we've got a real and we have got a clear direction, a clear vision. And I tell you, it can only be through a collaborative approach. It can only be through us. It won't be if it's me alone. Going forward, The Zimbabwe chapter looks forward to entering more strategic alliance with global health training institutions, of course, such as this one with BSQ, to Sanjay and his team. We further intend to register our great visibility in the health supply chain systems by mobilizing more membership, participating in health forums, and entering into more MOUs with local international public health bodies. And I think we've already started this. Quite a lot of things are happening in the background, and we share with the members anytime soon. As for the year 2023, the chapter looks forward to roll out task force approach designed to establish a particular task force team that relates to a specific objective as shown on the screen. I think it's unfortunate we didn't probably make it do so. It's shared lately. But just to describe and explain a bit background to the approach that we intend to do. I think as some of you may see through our objectives, like this banner, we've got 4. Sorry, Sanjay, I'm explaining a bit, but just for the members, take note. Okay, so I've got 4 objectives in the chapter. And I tell you, we've currently worked on only one objective, which speaks to safeguard and promote public health through coordination, professional exchange, and action. That is research and training. And you can see that of the 3 quality medicines, the medical supplies, through the supply chain, we haven't done anything. And the idea to promote and develop and enforce effective supply chain management, humanitarian response settings, we also haven't done anything. To provide life-saving health services to affected communities, we also haven't done something. Sanjay, I'm sure you're also following. There's quite a lot that we need to do as a chapter. And I tell you, colleagues, of you, probably we've come across this and you are yet to volunteer as a member to participate in this task force. I urge you, those who are here present and those who are following online, to do so. We really look forward to do massive, and the massive can only be so through, a collective support. Otherwise, I will continue to speak. I would like to say, having said that, I hand over the proceeding to the Director of Ceremony and to the graduates here present. I would like to say, go well and practice. Otherwise, I thank you, colleagues, Tatenda and Siabong. Thank you very much. Thank you, Sandra.
Thank you so much, Dr. Chabaya and the entire IAPHL team. It has been a great first cohort with the collaboration of one of the most active IAPHL country chapter globally, as Dr. Chabaya mentioned. And I think, as Dr. Chabaya mentioned his own objectives for IAPHL Zimbabwe chapter in 2023, all of you should be happy to know that we will be bringing more programs and better even better opportunities than we have today in collaboration IAPHL Zimbabwe chapter and CMCOMS in this year with new courses and other skills which you can develop as professionals. And of course, the current courses will stay for all of your colleagues and all other health professionals in Zimbabwe to learn as well. So I really appreciate Dr. Chabaya's presence and all the efforts that have been made to make this a success. At this juncture, I would also like to welcome Priyanka, our community manager who has joined us. Priyanka has been instrumental in making sure that the operations of this. Hi, Priyanka. Operations of this cohort, is smooth, and I think all of you must have spoken to Priyanka at any given point through emails or chat or calls. So I would like to give a big round of applause to Priyanka to manage all this. Now, moving on, I would like to invite Ms. Petronella Murambinda, who's currently working at the UNDP. But I know her from the time when she was at NCAS. And as you see on screen, she's an expert in supply chain, in pharmaceutical regulatory, She has worked in Zimbabwe at different levels of healthcare supply chain, healthcare system, from retail to policy to regulatory to supply chain to donor coordination. She has a big CV, so to say. Recently, she has left the ministry where she was for a long time and has joined the UNDP as a health product logistics and supply chain specialist. She was actually part of the first ever quality assurance committee or task force, which was created in 2014, when I think the first time I interacted with her. And she has been instrumental in the fight of COVID-19 as well in the country, as she was the focal point of procurements for personal protective equipment, diagnostics, oxygen, and a lot of other supplies which were needed to fight COVID-19 pandemic. So without further ado, let me stop my screen share so that all focus is on Petronella while she is in front of the camera and shares her talk with everyone.
Afternoon, everyone. So it's always an honor when you think you're just doing your day-to-day work, then someone reaches to you and say, your personal journey inspires us. Can you come and give a talk? It happened about a month ago. So I was quite surprised that, Sanjay, you really think I have an interesting journey in supply chain and logistics? But he said, yes, you do. Then I was like, oh, okay, let me sit down and write what I've done. So it's only when you detail what you have been doing that when you realize, oh, really, it's been a day-to-day job, but you have made an impact. And I hope after this talk, after the certification,
Wilson, I think your microphone has been muted somehow. Can you check the system?
me.
Okay. Yeah. Yeah.
No, good. Okay, so I was just asking if you could project my
Yes.
presentation.
Yes. 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 1 second.
Yes, so like I was highlighting that I actually thought I had a boring CV or resume. So when Sanjay and Priyanka reached out, I was quite amazed. So hopefully after today, you'll also be inspired somehow as I take you through what I have attained in Zimbabwe as I was in the different levels within the supply chain. So basically my presentation outline is highlighted, but I think Sanjay has taken the first 2 bulletins, but I'll still just highlight them. So in terms of the outline, I'll talk a bit about supply chain overview, which I'm sure you're now experts on, so I won't delve much on. Then just indicate what my journey has been, the challenges faced, what we had to go through, either I as an individual or as a team. Then also attributes and CPD aspects, which are to motivate you. And then finally, you can have a Q&A if any. So in terms of the supply chain overview, I'm sure the diagram which is next, you are all familiar with their various versions of it. You have gone through the course with B-Skill, IFPHL, so I'm not going to dwell much on. But just to highlight that within any sector, be it health, education, whichever sector you are, logistics and supply chain is always the backbone. If those pillars do not work, nothing else will move. I think we are all aware with the recent pandemic on COVID that the driver to even trying to combat this pandemic was supply chain and logistics. If PPE was not available, then we could have lost a lot of lives. If vaccines were not distributed in the right conditions, to the right place at the right time, then we would have lost even more lives than what happened. So it is key that you have undertaken this course because it enhances whichever background you have. One of the issues which I always discuss with my colleagues at work is that, you know, as you see from my personal journey, I'm a pharmacist by profession. But if you ask me right now, I think I'm an expert in engineering, in environmental sciences, in education, in everything, because as you become an expert in supply chain, you will tend to appreciate each and every genre or specialty. So moving on to my journey, as I've highlighted, I graduated from University of Zimbabwe in 2010 as the pharmacist. So I'm a pharmacist by profession. After leaving school, I immediately joined the regulator, which is MCAZ, initially as a pre-range pharmacist for a year. Then after a year, I was now permanently absorbed into the organization as a regulatory officer. So one of my key jobs during that time was inspections. I hope there are no pharmacists here right now because I was. So I'm sure to say there was a petrodella at MCAZ there. So part of my day-to-day was to assess whether public or private health facilities to see if they are ideal to food storage or distribution or manufacturing practices. So you're like the police of supply chain. So you're not really, you know, people are not fond to what you do, but when you wake up and you do the job, you know what the bigger picture is, and is to safeguard public health. So during my years as inspector, that was from 2012 to about 2013. That was my day-to-day aspect. So in terms of supply chain, that component of quality assurance, quality control was my main focus. So in 2014, I left being an inspector, still within Ministry of Health, and got, I can say, promoted to being a quality assurance focal person. This is when I met Sanjay, and we conducted our first quality assurance workshop in Zimbabwe, and actually in the whole world, because there was never such an initiative. Usually, previously, people were concerned about just procurement, making sure that the commodities is delivered, but there was no quality assurance involved in that. So Zimbabwe was identified as the first country to start a quality assurance task force. We went together very well with Sanjay to set that up, and we came up with a quality assurance plan, which is actually still in use up to today. And our main focus now was not just mainly procurement and logistics. We now wanted to know that even at the last mile, whatever commodity we are delivering is actually being effective. Because at the end of the day, for be it a medicine or a lab reagent, my grandmother is the one who's going to take it up. So after 2014, I left quality assurance. I think I got satisfied to now say, no, I'm now an expert in quality assurance. I need something more challenging. So I decided to join the Ministry of Health as a procurement analyst. So the aspect was now different, but it was still part and parcel of the supply chain journey. So during my tenure as the analyst, it was from 2017 right about 2021. We're mainly focusing on global fund grants. So this included buying commodities for the kids, HIV, TB, and malaria for all public health, ensuring that we quantify, forecast them appropriately, they are delivered on time. If there are any issues, be it expiry, stocking out, you are answerable to that. Then I got proficient, then an opening happened where I was promoted to being a PSM manager. So it was now a step further. You were now responsible for policy making. We're not just buying the commodities. You were actually involved on what the aspect of PSM in Zimbabwe outlook would be. So like what Sanjay highlighted, I recently left this post. I think I'm just a month-year-old within UNDP because I left ministry in December to join UNDP to become a health product specialist. So this has been my very, short journey. So in terms of what is satisfying through this, all the different levels of positions which I have held. So being part of the quality assurance plan, we were able to come up with the first electronic adverse drug reporting system with MCAZ. I'm not so sure, is there anyone aware of it? Because even as a patient yourself, I think everyone here takes medicine. They should be aware of this. So there's an electronic system which was developed where if you react to a medicine, you can easily report on using your phone. So we were the brains, together with the team I was working with at MCAZ to come up with this. And of course, this improved reporting, because one of the challenges which was happening before was that a nurse in Morambinda Hospital needed to fill in a form. That form needed to be transported, to come to Harare, because MCAZ is centralized, so that it could be assessed and determined whether the causality was due to a medicine. So because of that, system, we had very poor reporting, but with the advent of the adverse drug reaction portal, we were able to actually increase our reporting and intensifying our quality assurance aspect. Then the other key achievement, which I'm proud to talk about, is the issue of the lab. Through support, of course, which we're receiving from Global Fund, we're able to ensure that the laboratories at MCAZ were upgraded to become WHO pre-qualified. So if you are WHO pre-qualified, it means anywhere around the world can send their samples to you so that you can test, and that result is internationally recognized. And at that time, I remember Zimbabwe was the second lab in Africa to become pre-qualified, and the first national lab, because the number one was a private lab. So it was the first government-owned or parastatal-owned lab to receive such an accolade, which was quite a great achievement. So what it entailed for the organization was that people could send samples from all over and test it, and they actually ended up winning agreements with other international organizations such as UN to test medicines on their behalf. The other key aspect of achievement, I think this just highlights the pre-qualification, which I've already talked about, where we even procured the state-of-the-art equipment. Yes, so this is what we did with the labs. Then moving on, when we realized that in terms of healthcare, one of the major challenges we're having, be it upstream or downstream, was the issue of power. And I think even right now, Zimbabwe is facing so many difficulties in terms of power outages. So we decided to embark on a Solar for Health project. I don't know if anyone is cognizant of it, where as the country became aggressive that we want to ensure that each clinic and each hospital has solar backup, and each laboratory also benefits from this. So MCAZ was one of the first organizations to receive such equipment. And Zimbabwe, I think if you go online to just say the Solar for Health project, which country has done it the most, Zimbabwe is #1. And it was through that aggression which we impacted to ensure that this happened. So in terms of now downstream, what we have done is we have 1,800 public health institutions. To date, we have managed to empower 1,045 facilities with solar for health in a space of about 3 to 5 years time. So we are hopeful that in the next 2 to 3 years, we'll be able to have solarized every healthcare center. And the good thing about this is that your commodities are going to be stored according to the correct condition, but there are also community benefits. People can come and charge their phones, and if they come to charge their phones, their health-seeking behavior also improves. So you can see how supply chain impacts at different levels. So moving on to the other, yes, this is just a building showing MCAZ, the solar panels. If you pass through, it's just down the road, you can actually see this. This is what we did. Then the lab again. then yeah, I was just highlighting the ongoing projects. So here we are also doing the solarization of our boreholes. We are drilling boreholes to ensure that we have good sanitization. So what I just want to highlight is when you're a supply chain expert, you need to be diverse. Don't think within a box. You need to adapt to situations so that whichever gap there is, you are able to bring out a supply chain or a logistics solution to it. Then, yes, this is another I think this was Chichigam Pono Clinic. And Tanya, so next time when you see all these solar panels, you know where they came from. So now just indicating, yes, I've talked about the key achievement which has happened, but the picture is not always as rosy as this. Whenever you go out, whether, like I said, whichever sector you are in the health sector, there are always challenges. So as people who have just finished the course, I've put some challenges on my slides. You can move on to the next slide, and hopefully you can identify what the challenge is. You can move on to the next one. The next. Yes, yeah, you can stop here. So I'm not so sure if it's visible. What is the challenge? What's the supply challenge there? For people who have just completed the course, I'm sure it's easy to see. So I think this was my field visit last year to Marsh West. And I got into the storeroom. This was what was happening in the storeroom. This is where they store their PPE, their medicines, ARV, TB, malaria. What is the problem there? Yes, ma'am.
The products are on the boards.
Exactly. So you can see they are stored directly against the wall. And the challenge with that is that there is deterioration of medicine, which can be caused by moisture, isn't it? Then what's the other issue, which I thought was glaring on the first one? This one.
Okay.
Yes, sir.
I think the cat books are not properly placed like they are supposed to be the position like
You can't even tell what is this.
yes.
So the challenge there is that you can easily pick the wrong medicine, isn't it? But there's something else which is problematic there besides the way the boxes are arranged.
There's no order.
Except there's no order because
Chaos.
there's no space.
There's no space.
There's no space to, you can see the width of the shelves and the volume of the boxes. It's not consumer rates. So if you look at our public health sector, when the infrastructure was constructed, I think we had no HIV, we had no COVID, we had not much of TB. The malaria, I don't think it was even there. So in terms of the number of lines they were dealing with, it was not that much. So these shelves were adequate there. But now with all these diseases propping up, it's no longer, sustainable. Especially now when you see a box of masks, it's way bigger than this. And one box lasts an institution maybe just 2 hours. So you can imagine the volume which had to be brought to a facility. So this posed another serious supply chain challenge. You can move on to the next. I hope the figures are also clear, so I can just tell you, this is the data logger reading. I went to, this is Chirezi. So you can see, this is 16 degrees here. Yeah. This is 44.
Yeah.
This data logger was in a refrigerator with
What?
cold chain product.
Refrigerator.
In a refrigerator. These are the readings. What do you have to say?
There was no refrigerator.
Exactly. I was saying, why is this data logger even there? Because you can't say it's a cold chain. There's no refrigerator at all. But these were the temperatures which were being measured. You see, so at the end of the day, is there any quality product going to be dispensed from that place? Definitely a no, right? I don't know if I added another slide, just move. So this should be the last one. This is a pharmacy. Unfortunately, it later burnt down last year at Bucket Hospital. Those who are aware of it.
Yeah.
What are the issues there?
Yes. So,
So this is the roof.
so the ceiling actually has got an effect of controlling temperature. Without the ceiling, it means direct heat is coming from the.
Exactly, exactly. So there's no protection at all. And if you could go back, Sanjay, sorry, to the previous picture, you can see, yeah, these are my tools. I don't know what you call them. Termites.
And,
There's actually a sign of termites infestation there.
and the aircon is blocked by those boxes.
Exactly. The aircon is blocked. So what air conditioning are you putting there? So if your eye is not, quick enough to pick this as an expert, you just say, no, everything is fine. So it is our mandate as supply chain logisticians to ensure that as much as we procure a commodity, we maintain its quality throughout the supply chain. So these are some of the things which we are coming across on a daily basis, and we're trying to resolve and solve. And this is what gives me satisfaction. You can move on. I think this is another packed warehouse, which I just needed to highlight. You can see the way here. So if you need to take medicines from this box, how are you going to go up?
On top of the those kubus there.
And what's the other? This is alcohol, sanitizer. What's the danger of sanitizer and medicines? If there's a little spark or if there's heat, it's
Blow.
alcohol, it's a ticking bomb, right?
Yeah.
And this is what happened when buckets
Hospital.
bent down.
Okay.
The trigger was sanitizer. So you need to be cognizant of all these things and bring solutions. So ideally now, what should have been done, maybe store the sanitizer separately somewhere where even if a disaster happens, it doesn't, affect the condition of the commodities we should have prepared. So just to round up my presentation, in terms of how you can become a supply chain champion, because I would like to think I'm now one myself after Sanjay highlighted to me that in every situation you have to adapt with agility. So you have to be quick thinking, if you see, sometimes it's not a matter of resources, throwing resources at it, but it's how you use whatever you have within that confinement to ensure that you bring out a solution. So for example, the issue of sanitizer, if there had been separation, probably the whole pharmacy wouldn't have burned down. If the issue of the data logger, if they had been checking that, no, this thing is recording 44 degrees in the refrigerator, the refrigerator is not working, the medicines have already deteriorated, they could have looked for the problem, why it's not working, then brought up a solution. So you should be able to adapt and you should think innovatively. I think with COVID, we all learned how to think innovative. I remember when the first lockdowns happened, our monthly stock levels of ARVs was very low, and yet the whole world had shut down. So what were we going to do? Were we going to tell our ARV patients, patients that you can't receive your medicines? You couldn't, right? You had to find a solution, even amid a new situation to you yourself. But with such courses, I think you become equipped that whatever life throws at you, you are able to think innovatively, throw solutions at it. Because I remember as a PSM manager, that was during the time COVID, thereabout, the PS just came and asked the team, so what are you saying? I need my ARVs now. I need my patients to be on ARVs. They can't default. You can't be telling me the Chinese suppliers or Indian suppliers they've shut down. What are we going to do as a country? You see, these are the questions you'll be asked in whichever capacity you're going to work, and you have to proffer the solutions as an expert. So you should learn to always think innovatively and all you are doing is trying to achieve the results, right? Because that would be more satisfying. Then lastly, learn continuously. I think it goes hand in hand with the CPD point, which I highlighted we are going to talk about. These courses are very critical, which are being offered. I always laugh when I was at ministry, because when I joined, I think I was the second pharmacist to join the buying unit. So there was always a tiff, why are pharmacists now, evading our territory, because we are buyers, isn't it? That is it. But if you learn anything continuously, you become an expert at it. Like I told you now, because of the solar project or constructions which we are doing from farmers, if you give me a drawing from an engineer, I can actually read it off, because I've continuously tried to learn various skills and equip myself so that I'm knowledgeable. So do not take these courses lightly, which you are offered. Always invest in learning, whichever sector you are in, because at the end of the day, you become definitely an expert at it. So with that, I thank you. I hope I've inspired one or two people. I don't know if there are any questions, any areas where you need clarification. Thank you very much.
A big round of applause for Petronella from both the participants there and on the call. So Petronella, thank you so much. It's so great to hear from you your own journey, which I know we have met several times in different places and interacted, and it's so heartwarming to see all this that you have achieved so far. And I hope it has motivated all the learners and professionals who are there today. So any questions for Petronella? Maybe anyone in on Teams or anyone who's sitting there, please let's just take a couple of minutes to ask the question.
Yeah, I think there's one here.
Thank you very much for such an inspiring road. I really got sad. I was nearly in tears when you presented that data logger, information. We've got a fridge getting to 44 degrees. And there were people there. Was it open? Was it functioning, the fridge?
Definitely not. It wasn't functioning. It was on,
Yes.
but it wasn't functioning. And what was when we dug further, we realized this refrigerator is a domestic, the one where you store your vegetables.
Yes.
It's not suitable for farmer grade refrigeration. But because the institution was trying to make do with what they had, they thought if we put in this domestic refrigerator, something could be attained, but unfortunately, nothing was being done.
So the learning point there is, I don't know how we then, as supply chain experts in the making, and some are already experts here, how can we enforce that all storage places, especially for the cold chain, we need to have purpose-built refrigerators. Where I'm working, there's also a vegetable refrigerator. Here, I store my oxytocin. You understand? I really can't convince them, but they will always say there's no money.
Exactly.
But how then can we work together, maybe including IAPHL, this learning and everyone, so that at least all organizations, including the public, they make sure that we maintain our products with good quality, especially these refrigerated products.
So I think that's a very excellent question, because what we realized even before there was a data logger, we knew that these refrigerators could not store, could not maintain the conditions we wanted. But for us to just approach with whichever principal or policymaker to say, no, I need a new refrigerator because it's not storing according to the appropriate condition, no one was going to be convinced. So what I can, how I can answer that is, as supply chain experts, throw data at people. If you use data, they'll appreciate it. Go with this graph. Just show them that, do you know, sir, that from this day to this day, the temperatures were as high as 44 degrees. Will anyone taking the oxytocin actually be taking oxytocin? If you hit back with data, believe you me, whoever is a decision maker will not stand in your way because you have provided the evidence. But if we don't use evidence-based, solution, then people will not take you seriously. If you have a vegetable refrigerator, believe you me, with such a data logger, they will stop buying stationary or vehicles or whatever for the managers and prioritize buying a farmer grade refrigerator. So that's what we did. We compiled all this information so that we could pitch the idea to replace all cold storerooms with appropriate ones in the public health sector, and even the international organizations such as Global Fund gladly availed resources to that. So even in your own workplace, use data to support. No one will fight you back if you have such a scenario.
Let me add something to Petronella, you just mentioned. I'm not sure who asked this question, but I think along with data, one more thing that all of you must start to do whenever you face such issues where you need to replace something or add new equipment, which is absolutely necessary and it requires funds. Sometimes if you just speak by yourself, your voice may not be heard, even if you have data, because you're just one person. At those times, you need to come back to these forums like IAPHL or even the community that we are building in Zimbabwe. You should act collectively, collect data from all other places. See the issue that you are facing with, if someone else is also facing or not, and then create a collective case. And once you do that, you will see that the decision makers will have to take action because it's the same issue which is happening across the board and they just can't hide, So try to use these forums like IAPHL, and even if you need more understanding of the data, you need to create a paper, you need to, write a presentation. Just reach out to all of us. It's a community that we are creating. Take help of these communities when you face such issues. Find solutions collectively and present it to the decision makers with data, of course. And I can assure you, if you are more in numbers, people will have to listen to you. So thank you so much, Petronella. Let us move forward with the session. But Petronella, just let us know how long do you have? How long are you with us so that we can plan the picture in that sense? Because if you need to leave, then we will do it earlier. Or if you have some more time, then we can just do a few more things before we, wrap the picture.
All right, Petronella is with us up to 4 o'clock, so we still have got maybe about 20 minutes.
Okay, excellent. So just then, in that 20 minutes, I think if I quickly go back to our agenda, let me see what was the next. Okay, so before we come to distribution of certificates, Wilson, just one quick thing before we start distribution. I just want to see if Gilles is with us. Gilles, can you hear me? Are you with us? Okay, yes, he is. So, excellent. So let me quickly introduce Gilles Marion, who's the Director of Education at B-Skill. He is joining us today from Paris. Let me actually, Gilles, put you on spotlight so that it's easier for everyone to see you. Excellent. So Gilles, looks at all the educational initiatives at B-Skill, and he is at the forefront of all the programs that we do across various countries. He by profession, he is a health and humanitarian supply chain professional. He's in fact also worked in the private sector in the same space. from organizations like UPS to Oxfam at a global level and also at a country level in Africa. He has extensive experience in various regions in Africa, in supply chain and also in a lot of health topics. Without further ado, I would like to invite him to say a few words of motivation and also, provide a bit more insight of what else are we doing in other countries, just like we're doing in Zimbabwe. So, Gilles, over to you.
Thank you, Sanjay. Good afternoon, everyone. And thank you really for your participation, for taking this active contribution to the course and contribution to the supply chain, public health supply chain journey. I heard a lot about the work that's been done and the great successes, the very, very high rate of successful certificate which have been awarded. So really, congratulations for that. I'm sorry I could not be part of this session because we are running a session, similar session with Madagascar right now, and I have this chance. I don't know if it's a chance or what, but being a French-speaking instructor, I had really to be mobilized on this session, so could not join yours. But really, I heard great things about it. At B-Skills, really, what we believe in is collective learning. You've learned that. Sanjay mentioned it also when you're doing when you want to do advocacy for a point. Is together we are stronger. And really, we believe a lot that when people go through similar pathway for learning, they will be able to work together. They will be able to collaborate. They will understand what they mean on different subject, different theme, different concept, and different practices, and they will have the same perspective on their responsibilities and how they can answer the challenges of their work and their organization. So that's why we really believe in this collective learning. That's why we are really pushing for this knowledge of supply chain to be disseminated, to be accessible in the easiest manner by the largest numbers. So we are very happy that you've taken part of this journey. We really hope that it's going to be a collective journey that's going to take us all towards supply chain excellence, as we say, supply chain relevance, excellence. We are relevance and performance. We insist a lot on the performance of a supply chain organization, but if you are performant without being relevant, it would be even better not to be too performant, if you see what I mean. So performance always come first. Relevance always come first. And the relevance is really the strategic dimension. It's really the collective dimension. It's understanding jointly what we want to achieve and how we build our supply chain. And that's why in those courses, we insist a lot on the concept. We insist a lot on the definition of the words, understanding, some of the key stakes around supply chain. Also trying to go at the very practical level, but we know that the understanding of the concept is very important. The shared understanding of the concept are very important if we want to be able to be relevant and then, of course, performant. And that's why also we are talking a lot about the data analysis. I know that when we talk about data, we automatically we all think about quantitative data. Quantitative data. They are very important quantitative data to understand the performance of the supply chain. But if you want to understand the relevance of the supply chain, again, it's about engaging with others. It's qualitative analysis. It's a narrative about how the supply chain is working. It's engaging among yourself, among peers, to be able to define, to put the right wordings on the supply chain, but also engaging, obviously, with your client and your beneficiaries and your partners in the supply chain to understand how they feel about the service. So really those two elements about, first being collective engaging people, being qualitative and quantitative, to be relevant and performant is really what drives us towards supply chain excellence. Again, we cannot achieve that as one person. No man, no woman, no person is an island. We are all together, and we try to achieve jointly, the best for the service of the people who need access to health. The last thing I want to say to conclude, and not to take too much of your time, is that yes, my role in BSkilled is to ensure that the didactic method, the approach to education and to learning are the most effective. That's my responsibility. We do distance learning, so it's not always easy to optimize the engagement, the contact. I want to ensure you that we try our best to make sure that the learning approaches, the learning tools, whether it is the videos, whether it is the quiz, whether it is access to document, whether it is the short pills, learning pills that you can get from the micro-learning sessions that you can get from the Hive, the interaction on the form, all this, we're trying to make it, elements that are going to develop and build the training and learning capacities of everyone. So if you have any suggestions that you want to make to improve that, anything you want to say, whether it's just to say that, yes, we enjoyed the practice we are done, but we think that maybe something could be done a bit more on evaluation, on the test, on we would like to have access, for instance, to the entire course before, all those kind of things, please tell us, because everything, every input, every perspective that you send us will be a real asset for the growth and the spread of the message that we want to spread. Again, I want to end here by really thanking you for the work you've done and congratulating you for the work you've done, and hoping that we are going to do a great journey together. So, merci beaucoup et à très bientôt. That was French.
Thank you so much, Gilles. Always a guiding light for us, and I hope in future we will also find time for you to be part of the active course as well. But at least you were able to talk to the students at the end. Maybe next time at the beginning. Wilson, maybe before we move on to distributing certificates, if we want to take the group picture now, or what do you suggest? Should we move on to certificates? I totally, whatever you suggest, we can do next.
I would have loved to have the presentation of certificates, the physical one, while Patricia is still around. Then at the end, we can then take a group photo.
Sure. Okay, let's begin quickly. I'm going to show the certificates on screen. So based on that order, whoever is present physically can take them physically, or whoever is with us online, they can take it online in any which ways you can collect it from Wilson. But as soon as you receive a certificate, please just share a few points of experience with us, with everyone. And if you're on call, so please turn on your videos as well. So give me a few seconds and let me set it up. So Wilson, we are going alphabetically in that order, and we will. I'm just putting the first certificate on screen. Quickly, let me do two as well. Okay. So Wilson, maybe in that order we can work. Priyanka, over to you in calling out the names, and then if they are available, they can take the certificate from there.
All right. Thank you, Sanjay. Am I audible?
Yes.
Okay. Andrew Zapata, final score 64%. Andrew Zapata. Do we have Andrew Zapata with us?
Andrew Zapata is most likely to be online. He is not physically around.
All right.
Yes, he works
All right.
about 600 kilometers away from Harare.
All right. So, Andrew, are you on call? You can unmute yourself and speak a few words.
Okay, Andrew is not here, so let's move.
All right. Next, R12. R12 Mangori Nyakabu. Final score 60%. Congratulations, R12.
Oh, thank you so much. I've done it. So it was good taking this course, and I appreciate the effort, the material that was there, and I look forward to get more certifications in terms of medical logistics. The good thing is I'm already a logistician, and adding up to what I know gives impact in terms of making sure that Zimbabwe is well, it has enough and adequate information in terms of making sure that products are moved, especially these pharmaceutical products where we are having a bit of challenge in Zimbabwe. So thank you so much. Once again, I did it.
Thank you, Andrew. R12.
Oh, I would like to. I would believe that one. Wonderful. Thank you.
Hands for me, guys.
All right. Next, we have Barbara Turonga. Final score 74%. Barbara Turonga, congratulations.
Okay. Wonderful.
Can say something?
Good day, team. I just want to congratulate you. I also want to congratulate myself. The journey wasn't easy, but finally we did it. Thank you.
Thank you,
Just a
Barbara.
comment. Just a comment. Barbara, she's from a company called Greenwood, and we had 10 participants from Greenwood Wholesalers.
Wonderful.
Wonderful. Next, Bellington Mondokwea. Final score 64%. Bellington, congratulations.
Good.
Did you say something?
Okay, thank you, Tim. I don't have so much to comment. Unfortunately, the exam was so tough. Was expected to score 90%, but hey. Anyway, thank you.
Also, the Bellington is from Bark Logistics. We also had 5 participants from Bark Logistics.
All right. Congratulations. Next is Blessing. Blessing
Blessing Gwende.
Wende. Final score 66%. Congratulations, Blessing.
Yes. Say something.
Hello, thank you, Tim, for the course. Thank you for the course. I hope next time you're going to give us a degree. We are looking forward to a degree. Thank you.
Very soon.
Thank you, Blessing. Okay, next is Brian Bear, 60%.
Brain Barre is not physically here. Maybe he's online.
Yeah. No, he's
All right.
not online currently, but he was. But congratulations to him. So let's move on.
Congratulations, Brian. Next is Charity Chitsiga. Final score 74%. Charity.
Yeah, Charity, you are online. If you can unmute yourself and switch on your video and speak to us, that will be great.
So Charity, someone is collecting on her behalf from the same company, Varike Greenwood.
Charity, would you like to speak? I see you online. If not, then we can move ahead. Okay, so let's move ahead.
Next is Sharman Mushena. Final score 64%. Sharman, congratulations.
This time I'm coming.
Congratulations.
I hope.
Please speak a few words, Sharman, about your experience and.
No, I think he's taking on
Charmaine
her
is
behalf.
from Bag Logistics. She's not physically present. So somebody
Exactly.
took the certificate on her behalf.
Okay. Next is Cosmos Vandazara. Final score 74%. Cosmos.
He is physically not around.
Okay, then we move next.
Okay, Emmanuel Chireru. Emmanuel. Final score 76%. Congratulations.
Speech track certificate.
I haven't got much to say, but this was my first online certification. And yeah, time allowing, I'm looking forward to doing more of the same. Thank you.
Great job done. Congratulations for such a great score. Next is Faith Dube. Final score 60%.
Faith, she's I think she's joined us online.
Yes,
Yeah.
she's online. So Faith, if we can hear from you.
Thank you very much for the certificate. I hope to get some more on this one. Thank you.
Thank you, Faith, and congratulations. Next is Frank Malunga. Final score 66%. Frank. Do we have Frank?
Okay, I think his certificate is being taken down.
Say something on behalf of Frank.
Okay, on behalf of Frank, I just want to thank Be Skilled for the course. I think you can see with our membership that we enjoy learning as a company.
Where's the company now?
Thank you so much.
I hope she's not going to take all the certificates home and put it on her own wall.
We have next Pangai Madzinga. Final score 76%. Congratulations. Pangai.
Thank you so much, Field, for affording me the opportunity to do this course. I really enjoyed the course, and I'm looking forward to do the CLC too. Thank you so much.
Next is Kudakwashe Viriri. Final score 76%. Congratulations.
How are you, everyone? Well, I feel humbled by such a great occasion. I learned a lot, and I look forward to learning much more. So I say thank you with this great achievement.
Sorry, Mr. Viriri, are you from the Air Force? Zimbabwe National Army.
Yes.
Mr. Viriri is from the Zimbabwe National Army, our defense forces.
Thank you.
Thank you very much.
Next is Kumbirai Bako. Final score 62%. Do we have Kumbirai?
Kubirai is not present.
Okay, are you online, Kumbirai?
No, he's not.
Okay, next is Leonora Shivara. Final score 78%, which I believe is the second highest score. Congratulations.
Good day, team. I don't have much to say, but I just want to thank God. Though the final assessment was a bit tricky and tough, but I'm willing to learn.
Thank you.
Thank you so much.
There are no free lunches. You have to find your way, you know. Next up. Priyanka, back to you.
Next is Lloyd G. Niarota.
Yes, the
Lloyd.
one from Pharmacist Council.
Yes.
Congratulations, final score 66%.
Yeah, at this stage, I would also like to acknowledge the support that the Pharmacist Council has given us at the very beginning by accrediting this course. So all registered and licensed pharmacists from PCZ, you will also receive CPD points from PCZ as well. So Lloyd, please say a few words about the organization and about your experience as well.
Thank you. Firstly, I would like to thank everyone who encouraged me. I think I was the last person in the group. I did the module 3 up to the last one on the last day when the exam was supposed to close. Then on my first attempt, when I got 66, I went to sleep. I never attempted to get a better mark because I was so exhausted. About Pharmacists Council of Zimbabwe. So Pharmacists Council of Zimbabwe, they've got the role of, or the mandate of registering pharmacy technicians, pharmacists, optometrists, as well as hearing aid specialists in Zimbabwe. They also do regulate the practice of all these mentioned cadres or professions. So our role is mainly to regulate and register them. Make sure that they are following regulations, ethics, as they have learned at school, as they have learned even within their trainings. So this is Pharmacist Council of Zimbabwe. That's what we do. This is my third year. I think I was elected into Pharmacist Council of Zimbabwe 2020, and our term ends in 2025. Let me say, I've learned quite a lot in terms of governance, in terms of leadership, whilst there. So I want to then ask everyone here that don't look down upon yourselves. Aim high. I've stood next to the vice president, like the way I'm standing to Murambina right now, because of Pharmacist Council of Zimbabwe. So let us not look down upon ourselves. But let us strive, even to strive as like our guest of honor is done. She's rubbing shoulders with Sanjay and Priyanka. We can do the same. Thank you very much, Sanjay. Thank you very much, Priyanka. Thank you very much, Ms. Marion. Thank you very much, all the attendants to this particular graduation ceremony. I thank you.
Thank you so much for your words, Lloyd. Next is Lynette Gonyamo. Final score 70%. Congratulations, Lynette.
Thank you for the opportunity to learn. It was also interesting interacting with other cadets in the thing. We learned a lot and got to interact with others and also learn their different fields that are in. At first, I thought it was pharmacy personnel. Then I got to know that we are all in one. There's a lot of people cadets in the supply chain. So thank you for the opportunity.
Thank you and congratulations. Next is Makosi Sibanda, the highest scorer with 80% score. Makosi Sibanda, congratulations.
Thank you, Priyanka. And thank you for this certificate. It's quite an honor as well to receive it. In my words here, I would like to thank my fellow participants or colleagues for your insightful experiences, as well as shared knowledge within the chats in the group on Hive, as well as in the class. I think I wouldn't have done it without you. I think you made it easier. Thank you so much.
Congratulations, Makosi, and we look forward to more in Botswana through IAPHL that you are trying to set up. And I think with IAPHL Zimbabwe and IAPHL Botswana, and through a collective effort, we can elevate all the fellow health professionals who are involved in supply chain. So thank you so much.
Indeed, thank you so much.
Well done, Makosi. Makosi is my former workmate. He used to be the managing director of CAPS Botswana. Well done, Makosi.
Thank you, sir.
Great job, Makosi. Congratulations.
Thank
Moving
you.
on, next is Maxwell Chivanda with final score of 74%. Maxwell. Congratulations.
I would like to thank our organization for giving us opportunity to learn. I also want to thank you all for mixing and mingling as professionals. We are looking forward to learn more. Thank you.
Thank you. Next is Maxwell Nahamo with 72%. Maxwell Nahamo, congratulations again.
Yes. The largest wholesaler PCT, that's the difference between biggest and largest. Okay. I've been receiving so many certificates, but always remember like the first one. Always enjoy to receive a certificate from learning with colleagues like you. I appreciate, naturally we are pharmacists and medicines experts by profession, but I'm sure in a year's time I will be a logistics expert. Like, just thank you.
Thank you, Maxwell. Next is Moses Simbarashe Musona with final score of 60%. Moses. Congratulations.
Greetings, everyone. Congratulations to you, colleagues. Thank you for this opportunity, and I hope there's more certification coming along the way. Thank you.
Thank you, Moses. Next is Nyasha Gladwell. Nyamatanza. Final score 64%.
I think he's not around.
Okay.
Yeah.
Moving on.
Okay, let's move ahead.
Olga M. Moza. Final score 70%. Congratulations, Miss Olga.
Ambassador.
Ambassador.
Yes.
Thank you. Congratulations.
Okay, hello. All I can say is I don't give up easily. I did the final assessment last night because the first 5 attempts I was down there in Chikombedzi and I failed. So I said to myself, no, I won't let this chance pass. So I tried and then I passed last night. Thank you. Thank you,
Congratulations,
Sanjay.
Olga. Yeah, congratulations. We really are delighted to see you achieve this certificate. All the best.
Thank you. And also just to say, thank you, Priscilla. You said be diverse. I'm from an HR background and I'm now trying to penetrate into the supply chain. So thank you, Be Skilled. I look forward to do more courses with you.
Indeed.
Thank you so much and congratulations. Next is Patrick Monamba. Final score 64%. Congratulations, Patrick.
Patrick is not physically present.
Okay. Next.
Okay. Next is Ronald Jetshe. Final score 64%.
Ronald from the port manager from Back Logistics.
Congratulations, Ronald.
Yeah, say something, Mr. Jesse.
Okay, good afternoon, team. When I was sitting there, I wanted to say the exam, I think it's this course is undervalued. It's equivalent to a degree. But then when I saw someone scoring 80, I asked my questions. So I saw so many questions. So I need to improve next time. So like you're saying, I'm representing Back Logistics. Thank you very much, Back, for the opportunity. We have also applied to be a port of entry for pharmaceuticals. We've had our first assessment with MCAS. We are waiting. I think the certification should be available anytime soon. So yeah, from now or from maybe a month or so, we'll be a port of entry for pharmaceuticals. Thank you.
Thank you, Ronald. Next is Senzelve Matero. Final score 64%. Senzelve.
Yeah, Senzelve, are you available online? Yeah, are you available with Faith?
Available online or?
Excellent.
Thank you.
Okay, please speak a few words and congratulations.
I'd like to congratulate Senzelve Mtero. We were working together and I hope he did. I noticed that he did very well. We hope to do more together. Thank you.
Thank you so much. Moving on, Sharon Chido Matenga. Final score 68%. Sharon.
Sharon? She's not around. Yeah, she's not around.
Okay. Shuvai Mondia, congratulations, 60% score.
Shuvai, you are online. If you can switch on your video and mic and say a few words.
Thank you. On behalf of Shuai from Back Logistics, we appreciate the knowledge that we are getting from Biscuit, and we look forward to continue learning. And thank you so much.
Thank you. Next is Synodia Cheryl. Final score 76%. Cheryl.
Yes, Synodia, if you are available online, if you can say a few words, or yeah, someone is collecting. Okay. All right.
Tafadzawa Ashley. Gogodo. Final score 62%. Congratulations. Taka Fanana Isaac Zowa. Final score 64%. Congratulations, Isaac.
Thank you very much. First of all, I'd like to congratulate everyone here present and those who are online. I'm from Wange. Yes. Yeah. I really wanted to score 90 or 100%. But when the course was happening, I was doing what is called the SAPS run. That's a program for the Ministry of Health for ordering for facilities. So you know, Wange. How many keys from Iraq for them to know? That's about 655 keys from here to Wange. So in the field, you know, Wange, we discourage poaching very much. So the network is actually deliberately jammed. So it was not really easy for me to go through all the classroom sessions and other things. But thereafter, after the run, I managed to go through the lectures and everything. Thank you very much. Thank you.
Thank you, Isaac. Congratulations.
Congratulations, Isaac, and we appreciate all the efforts.
Tariro Hazel Zidya, final score 78%. Tariro Hazel.
Greenwood. Greenwood.
Thompson N. Mutondoro, final score 74%. Congratulations, Thompson.
It's not around?
Okay.
Okay. Valerie Muzere, final score 64%. Valerie.
Yeah, Valerie, I think you are online. If you would like to say a few words. Okay.
Valerie is the managing director for Greenwood Wholesalers, one of the biggest pharmaceutical wholesalers in Zimbabwe.
Yeah, maybe Valerie would also like to speak. Valerie, back over to you. Valerie? Okay, no problem. Okay, so that was the last certificate. So, Wilson, what do you want to do next? Do you want to do the picture, or should we go on with the couple of slides that we have?
Come again?
Yeah, Wilson, do you want to do a picture, or do you want to do the few slides we have? Am I audible? Hello?
Yes, you are, but I'm failing to pick. Let me reduce the volume here a little bit.
Okay, no, I'm just asking, do you want to do the picture now, or do you want me to go through a few slides that we have?
Go for the few slides.
Okay, excellent. All right, so very many congratulations to all the students who have received their CPD certificates physically and also virtually. If you have not received your certificates physically, please contact Wilson. He will make sure you get it. I have a few slides just to show you the results of this cohort. So at the very beginning, initially we had 39 learners in total, but two of them, unfortunately, they dropped out at the very beginning for some personal reasons. They will join us in the next cohort. So out of the 37 learners that we had, we have a 96% completion rate. I think all of you must clap for yourself because this is the highest completion rate that we have achieved in any cohort that we have done in the past, and this is actually the 11th cohort that happened in Zimbabwe. So congratulations to everyone. And then, of course, the average group score of the final assessment was 68%, which I think is quite high. And there is a scope for even higher achievement in the future cohorts. In the weekly sessions that we organized, more than 80% people were always present, which is great. And then all the discussions that we organized on the Hive, there were about 690 responses from collectively from all of you in 4 weeks. And that is also an achievement for a cohort to have all these many responses, which shows the level of commitment and the hunger for information exchange within all of you. So congratulations to everyone, and we hope this commitment towards learning and this profession will keep on. At the end of the program, there was an evaluation as well. We take those evaluations very seriously, and whatever suggestions and feedback that you have given us, we will definitely take a look at those in the future cohorts as well. However, I would like to share these ratings that we have received. So on an average, in 37 responses that we have received, the course experience was rated at 8.3, which is really great. And I really sincerely thank all of you that you have found the course as per your expectations. 90% of the students feel that the learning outcomes have been fully achieved, which is great. And again, we strive towards excellence in this sector through our programs and the way we engage with everyone. So I hope this rating will even improve in the future when we do future cohorts in Zimbabwe. And finally, when we ask this question, that was the course worth your time, we've received a 100% rating in this sense. So it has personally made me really happy that all the effort that we have put in, collective effort from all of us sitting here, then IAPHL Zimbabwe and CM Comms, it was really fruitful, which has led to a lot of learning and possibly change in professional behavior based on the new skills that you have learned. So real congratulations to all of you and everyone from B-Skill, IAPHL Zimbabwe and CM Comms who have been involved in making this a success. We've also received very excellent reviews as well on the course page. And if you have not submitted your review on the course page, I would really request you to do that, because these reviews motivates us to do even better and also helps future participants to understand what the expectations are and what they can expect, and what can they look for out of these training programs. We've already covered this. Okay, so but let me just quickly talk about the features of your certificates and other things on the Hive. So your virtual certificates actually has 2 pages. The physical one, we could only print the top page, which is the certificate itself. But in case, if you are applying for a job or anything else, you should definitely submit a virtual certificate, which also talks about the various modules and learning objectives that you have gone through. This certificate is awarded through our partnership and accreditation with the CPD certification service based in UK, who are the biggest certification agency for continuous professional development program. We also are accredited by Pharmacist Council of Zimbabwe. So all the participants who are licensed pharmacists, we have only received 2 names so far. So if there are more, we will also
We have received
accredit
4.
4 names.
Sorry
Okay.
to interrupt. Yeah.
Yeah, so 4 names. So we will also submit your names to the council to accredit 24 CPD points nationally as well. Then the certificate has a identifier, unique identifier, which is written on the bottom right. In case any of your current employer or future employer wants to verify with us that indeed you are the one who has learned all this, they can just send this very unique number to us, and we will verify about your successful completion of this program. And finally, on the Hive, you may have seen on your profile, you have received 24 CPD points from this program and 200 gems. The beauty about gems is that in future programs, you will be able to utilize some of these gems to receive additional discounts, so that, you receive more discounts when you pay online directly, to enroll in other programs. So please make sure you use those gems in future. Okay, so Wilson, do we move ahead or shall we do a picture? You are muted, by the way.
Yes, yes, we can do the group photo.
Okay, so then if people who are online, if they can switch on their videos, and then Wilson, you decide where you want to do that with the group. Maybe you can do a couple of pictures, one just the group who's there, and rest of it just be online. So you
Guys,
decide.
can we all come? Can we all come this side? No problem.
Yeah, it's good.
Yeah. So we can come this side. Just let's ensure that we are all fitting. Maybe go to the.
Maybe what you do, I can was a very snap.
All right.
So that you can take. Come with this.
Yeah, sure.
Wilson, maybe someone can take a picture in the room itself, and then Priyanka just take a couple of screenshots as well from your side.
Oh. Yes.
Wilson, is someone taking a picture in the room?
Yes, we are also taking pictures in the room. We are also going to be taking more pictures outside.
Excellent, excellent. All right, Priyanka, have you taken a screenshot? Okay, excellent. Thank you so much. Maybe we can go back to our seats if the physical picture is done. Oh, Faith is here. Maybe Priyanka, one more picture. Faith, can we see you again? Yes, excellent. Excellent, excellent. Okay, all done. So maybe we can go back to our seats, and just a couple of things remaining after that. It will be the networking event physically. So let me quickly go back to the slides. All right. So let me now come back to our highest scorer, Mr. Makhosi Sibanda, who's currently in Botswana, joining us online. Makhosi, please, the floor is yours. Talk about your experience and what do you intend to do next. Congratulations.
Thank you, Sanjay. Sorry, I'm wearing these phones. It's raining here, so you might not hear me with the noise. So yes, I'd never thought actually I'd enjoy doing a course, such as I did doing this CLC on supply chain and health. It was quite enlightening. I had a slow start in the beginning, I must say. I had a bit of encouragement from, of course, Priyanka and one of my colleagues who's, I see she's not online, Taro Hezo Chaiba. And once I got into it, I started flying and cruising through it, and I found it quite interesting. And this motivated me to keep on going, and my pace picked up. Of course, I wasn't on top of the leaderboard like your Andrew Zapatas. I see Bellington is there, your Faith Dube, and so on. But I managed to catch up, and even I think at one point chaired one of the group discussions on the online sessions in class, and did all the chats on the Hive. So I got quite engrossed in it. So it was really brilliant in terms of my involvement in there, which I surprised myself there. So I've seen a couple of supply chain management courses, some online, some physical, and good as they may be, I find them they're quite general. And this particular one really, is quite different in that it caters more for our healthcare sector, and it's quite specific to healthcare. So you find the other ones, they've got modules which may not be relevant to our industry, and we spend a lot of time on them. This one now actually zeroes in on what we do day to day. And I found this course quite different. So I think it was on its own really quite relevant. I'm in private sector myself, of course, as you heard, I'm based in Botswana, but I also am Zimbabwean, and as Wilson did say, I'm affiliated to CAPS. So I was with CAPS Botswana here way back, and we distribute CAPS products here, and really a lot with the public sector or the government. And as I was going through this course, I could relate to a lot of concepts, which actually gave me a lot of understanding of the very complex health supply chain. And colleagues, I must say, the public sector supply chain is very, very complex, and I think it does deserve a course on its own. And this course, I think if it gets a spotlight, could benefit a lot in public sector, because they'll discover a lot of processes that they do, maybe because they only know just their day-to-day jobs. There's a lot that links to the bigger health system, which they may not understand, and this course would definitely make them understand that. So for myself in private sector, this understanding therefore translate day to day to my better dealing with governments, be it your NatFarm or hospitals, as well as the Botswana Central Medical Stores. The systems are really the same. So I could really relate and found it quite relevant. And of course, during the course, we learned a lot about the key processes in supply chain management, including your procurement, your quantification, what they do before they generate a purchase order, all those processes that happen behind the scenes, which, us from the private sector, we're just seeing a GPO or purchase order coming, and you don't know the process that has led to it to come to that stage. So that understanding, I think, definitely would enrich my understanding, and then therefore my interaction with government, and I'm sure, even from a business point of view, boosts, the business that we do. So the modules ranged from all that forecasting and procurement, managing costs, and all this is really relevant and can work for anyone, even in the private sector, to enhance their knowledge of supply chain management. So it was really helpful content, and I must say thank you for putting it all together. So the delivery was held over 4 classroom sessions. I'm sure most of us attended that. I think we saw there that there was 80% attendance, so that was good. And there was also an app or a virtual platform called Hive. So Hive, is really excellent. It's got a lot of materials on there, lots of videos. I think you saw Gil there. You also delivered some of the sessions, and there's material there which I think all of us will keep on going back to, because it's got a lot of information that is put in one place. And lastly, really, the collaboration and interaction from colleagues was excellent, either in class or on the platform. Like I said earlier on receiving the certificate, a lot of insights were really gained from the comments that others would have put. So some are going back as far as 2 years, and that still applies and does help. So thank you so much, Sanjay, Priyanka, and Gil, and of course Wilson from CMCOMS. And we look forward to CLC2. And congrats again to my colleagues, and good luck. Thank you.
Thank you, Makosi.
Thank you so much, Makosi, and it's really great to hear from your perspective. It will be great in the future, like we are planning, to combine cohorts from Zimbabwe and Botswana. We are waiting for that opportunity when it is presented. But of course, colleagues in Zimbabwe, we will bring this course back again in this year a few more times, and the CLC2 course, which focuses more on your associated functions and enabling functions, will also come very soon. It's almost finished. It has recently received the CPD certification as well. And we have launched the French version as well. So the English version is coming very soon to Zimbabwe. One thing which I would like to say, and I think probably we have not said it out loud. This program, the one that you have gone through, as a member of the Hive, you will have access of this program throughout the period that you will be members of Hive. So there is a alumni group that we have on Hive. So Priyanka will make all of you members of that group. And as you become members of that group, you will be able to access this course anytime. So you can go back, watch any video lessons again. You can go back, look at the classroom sessions. You can go back, download any materials that were there. So everything which is there, you will have access to it for whatever time period that you are there. So don't worry about missing anything, smaller stuff. If you were not able to download, you can always go back and download them. You will always have the access. So I just wanted to make sure that you know this, so that you're not worried that once this course is finished, you will lose access to all the material. So I think with this, the main talking points of this ceremony is over. Again, we would, from all of us at B-Skill, IAPHL and CMCOMS, we would like to congratulate all of you. And we hope that you will come back for more courses through this platform and forum. And you will become a lifelong learning member of this forum that we have created in Zimbabwe. So at this juncture, I will hand over first to Mr. Wilson Chandomba from CMCOM, who's also associated with IAPHL. And then once Wilson's talk is over, then I would again invite Dr. Chabaya from IAPHL Zimbabwe chapter to formally close this session, after which all of you who are present there physically at Bronte, the Garden Hotel, and thank you to them for hosting us as well. It will be a community networking event open to all. I believe there are some refreshment snacks as well, which you can enjoy while you speak with all the participants from this course. So Wilson, over to you. And then hopefully you will open the floor for Dr. Chabaya as well. So, Wilson.
Good day to everyone. Congratulations to the participants for such a qualification. Thank you, B-Skilled Global, for trusting us in this part of the world in Southern Africa to partner with us and providing such a qualification, which is very relevant. Access to health, especially access to medicines, is a critical part, is a critical aspect of universal access to health. So as supply chain professionals, as pharmacists, pharmacy technicians, we play a key role. One of the things that are close to my heart as CM Coms is to have what I term good supply chain practices, good medical logistics practices, where you ensure that the medicine that you are delivering or that is in your hands will maintain its safety, efficacy, and quality throughout the supply chain up to the last mile. The other area that we are also working, representing B-Skilled in Southern Africa, is to ensure that this course also goes to other countries like Botswana, Namibia, and so forth. I would want to say this publicly. I'm appealing to Sanjay, consider turning this supply chain for health into a certification such that it becomes a certification program. The other available certifications are very generic. So if we can have a certification, particularly for health supply chain, that would come in handy. Once again, I would like to thank Priyanka, Sanjay, and all of us, including IAPHL Zimbabwe chapter leadership, for all the support up to where we are. Thank you so much. Over to you, Sanjay.
Thank you so much, Wilson, for
Thank you,
all the nice
Wilson.
words. Yeah, thank you so much. And I would like to invite again Dr. Chabaya to finally close this session as he had opened it, so that every one of us can go back to the networking and the community event at the Bronte Garden Hotel. Dr. Chabaya, we really happy and appreciate your guidance and your stewardship throughout this, and hopefully for all the upcoming cohorts that we have.
All right, we have got another official from IPLCL Zimbabwe who is going to do the closing remarks. Over to you.
All right, excellent. Thank you so much.
Yes, good day, Sanjay sir, and the B-Skilled team for this memorable occasion. I say good evening to you all, the participants, the invited guests, and all our stakeholders mentioned in their various names and in their various capacities. I would like to take this opportunity to convey the IAPHL Zimbabwe with gratitude towards the completion of this course, which was the brainchild of B-Skilled Zimbabwe in partnership with PM Coms, granted by our long trusted consultant, who is Mr. Wilson Chandomba. We appreciate you so much. As IPHL Zimbabwe, we are grateful and we have been honored as acceptable organization and acceptable people. That in every respect, we are blessed with the visitors and the stakeholders who has pushed our long-held vision of strengthening the health supply chain. One or south. I would like to
pay a special mention to one of our stakeholders who was so much involved in the delivery of this course, who is not here present, but is Mr. Obvious Mahunze, who contributed as a facilitator. I would also like to acknowledge and to thank other training stakeholders. We have our long and trusted partners who are helping us in the endeavor of strengthening the health supply chain systems. And in fact, the supply chain systems, which is, we can say they are the supply chain solution providers in this nation, who are back logistics, who have been, they have been standing with this organization for quite long. And in this course, they are well represented as participants. I would like to cherish and to thank their involvement in our vision. Going into the future, this IPHL Zimbabwe intends to continue strengthening strategic alliance with the training stakeholders who emphasize on practical problem-solving techniques and problem-solving trainings. That is, those organizations that are very agile, that are very quick in transforming knowledge gained mentally into practical solutions. And this is one of the major thrusts of the IPHL Zimbabwe in fulfilling the mandates and the dictates of IPHL Global. We would like to thank everyone who has participated. You have accepted and taken up the challenge. Now that you are mentally equipped, we implore you, graduates and facilitators, to continue in this journey. There are a lot of gaps, especially if we look at the supply chain system in Zimbabwe. We have so many challenges which need your involvement in tackling those challenges. So I implore you guys, with the requisite knowledge that you have gained from B-Skilled and CM Comms, for you to go and practice, for you to go and experiment, for you to go and bring solutions on the table. And this is not a theoretical sermon. It's theory into practice, practice into real life. We are in healthy supply chains, and a healthy nation is a wealthy nation. So healthy communities will bring healthy solutions. I implore you and urge you guys to keep and not to forget what has been delivered, what you have been blessed by Sanjay Saha and the B-Skilled team. I thank you, and I would like to convey our gratitude. As an association, we value your support. We value other stakeholders who are not here present. And on behalf of IPHL Zimbabwe, coming from the Presidium, my name is Blessed Nende. Others, they know the Presidium as the Secretariat. We are humbled to have such an enormous support, which is very rare to upcoming organization. And going into the future, we would like to see our organization strengthening its systems and increasing the visibility and the products we offer, even though currently we've not yet gone into physical products. But in the future, we have to touch on so many areas, because health covers a lot of issues. We still have areas in Zimbabwe, such as humanitarian logistics. Our area, geographically, we are prone to disasters. So disaster management, and which is under humanitarian logistics, is one of our core areas. So it's just a teasing moment that I'm giving to you, that we still have a long journey as IPH Zimbabwe, and we still have to open up other avenues, and we still have to proffer more solutions to the industry. And anything that is life-threatening attracts more attention. Speak people in remote areas, they are looking forward to us as supply chain professionals for their well-being and their solutions. I thank you guys. I thank you everyone. I thank you Sanjay sir and the team. We look forward to such strategic partnerships. We look forward to receiving such trainings, and it is a promise. This one was the first of this kind. As an association, we will encourage our membership, those who are not here, those who have not taken up this initiative, to continue taking up. So whilst Sanjay sir is preparing for the CLC number 2, I would request on behalf of the association that the CLC number 1 be slotted alongside the CLC number 2 for the fulfillment of our long-held objective of knowledge and research development. I thank you. Good day.
Thank you very much, Mr. Blessed. And I think in your name there is grace as well. So we really are thankful for your blessings to this group as well. And it is our promise that we will come back with more opportunities, and even the same one for even higher number of professionals in the future. I would like to just finish this by saying to everyone that this was a great journey. Many more to come. We are creating more programs. And Wilson, I hear you. I hear you that there is a need for certification as well, and it is going to come very soon. There is a process that we need to follow for a lot of things that are going on at the global level with B-Skill. And as and when we finish them, those will be launched in Zimbabwe like other countries as well. So with that, I wish everyone all the best for your future. Make sure you keep coming back to this community. We are all here for you. And we hope to see you soon in other programs. And finally, before I leave, I just want to again thank our staff, the backend staff as well, and of course Priyanka, who has been supporting all of you every day, every hour, whenever she looks at any query or any difficulty. And finally, the staff on ground from IAPH Zimbabwe, and Wilson, who has been the backbone for this program. So thank you all, and we wish you all the best, and we see you soon. Wilson, over to you for closing it, and we will leave you here online. The floor is there open for everyone to interact, and before going home, they can interact and have fun. But we will have to leave the online session. So thank you.
Thank you very much. Thank you very much.
Yeah. Bye, everyone. Have a good day, and take care. And we'll see you soon again in a few months. Bye-bye.
Let's just say thank you or something. Thank you.
Thank you. Thank you, team.
Thank you, Sanjay. Bye-bye.
Yeah. Thank you. Thank you. Bye-bye. Bye.